Hello from Williamson Health. My name is Michelle Simpson, and we're so glad you're listening to Health Talks from the Inside Out. So welcome, Elizabeth Schaeffer, board certified nurse practitioner at our Turner-Dugas Breast Health Center. Welcome to the podcast.
Thank you so much. I'm happy to be here.
Yeah, this will be fun. So we recently sat down with Dr. Rebecca Baskin, one of our breast surgeons over at the Turner-Dugas Breast Health Center, and she talked to us about breast cancer in general and the services that we offer to our patients. But we thought it would be good to have you come back in and help us bust some myths about breast cancer.
Yeah, I'd love to.
So you ready?
Yeah.
Okay, I actually have a list here, and so I will refer to these every now and then, and you can throw in some additional myths if you want to.
Great.
But the first one I thought we would begin with is only women with a family history of breast cancer are at risk.
That is a myth.
Okay, it's a myth.
That is a myth. We see a large portion of women that have breast cancer that actually have no family history of breast cancer. If you have a family history of breast cancer, of course, that is going to elevate your risk. But women with no family history of breast cancer, no genetic mutation, they are capable of developing breast cancer.
Okay, so hence why we should all be looking out and doing self-exams, getting our mammograms,
Absolutely.
and that type of thing. We all
Everyone
could be at risk, right?
Everyone.
And on the flip side of that, also another myth is if your mother or grandmother had breast cancer, you were automatically going to get breast cancer.
That is a myth as well. Yeah, so the risk is elevated with that, and we have a calculator that we can use to determine what your risk is. Of course, this is all theoretical.
Right.
So we can calculate, and you can definitely see that if you have a first or second degree relative with breast cancer, your risk will elevate.
Okay.
But it's not a guarantee that you're going to have it.
Okay. First or second relative, can you break that down for us in case people don't know?
Yes, so first degree relative, sibling, mother, child.
Okay.
Second degree would be your aunt, grandmother, niece.
Okay. So another one, men can't get breast cancer.
False. That is a
Okay.
myth.
Okay.
Yeah. So men can get breast cancer. It is not common. The greatest risk factor for developing breast cancer is being a female.
Okay.
And the second is aging.
Okay.
So men are often thought of to kind of ignore their breast
Right.
health, and if they notice something, a lot of them don't speak out about it. But they can develop breast cancer, and I unfortunately have seen it in our practice. It is easier for a man oftentimes to detect breast cancer because
Okay.
they don't have as much breast tissue.
Right.
So when they're performing an exam, it's easier for them to feel a lump or
Okay.
notice changes to the nipple than it would
Right.
be for a woman.
Wow.
Yeah.
Okay. So men should not be afraid to come in, speak up if
Please
they do
do.
notice something, because it is a possibility.
It is a
not
possibility.
as common, but a possibility.
Yes, absolutely.
Okay. Let's see. Speaking of lumps, a lump is the only sign of breast cancer.
False. That is
Okay.
a myth.
Okay.
Yes, that is a myth. There are a lot of different reasons why a woman might have a lump in the breast. Oftentimes, I will have a referral for a woman who feels a breast lump, and it ends up being basic anatomy. It's their breast tissue. And it can feel like a lump. It feels palpable. Sometimes it feels hard.
Right.
It can be tender. Women will come in, we'll do an ultrasound and a mammogram, and it comes back and it's just their breast tissue.
Okay.
So a lump necessarily does not equate to breast cancer. And then you might have a cyst in the breast, which is a fluid-filled lump. Benign breast masses that are solid could be a fibroadenoma. Some mastitis present with lumps. So there's a lot of different benign things that can be a breast lump.
Okay.
And then on the flip side of that, a lot of times breast cancer has no symptoms.
Right. Oh, wow.
And that's
Okay.
why you have to get your mammogram.
Yeah. As the most important kind
As
of
the-
consistent thing you're doing to check.
Exactly. It's the gold standard
Okay.
of breast screening, and any woman over the age of 40 should be getting
Okay.
a mammogram.
Okay. So this one says, if you do have a breast lump, it's definitely cancer. I think you kind of hit on that just a minute ago, but there are many other things that it could be.
There are many other
Yeah.
things, and the best thing to do is go and have it evaluated, whether it's your primary care provider, your OBGYN. Go and tell somebody, I have a breast lump.
Right.
Depending on your age will be the deciding factor of what we do to image that lump. So typically, if you are younger and you're 16, 17 and you have a breast lump, we're going to do an ultrasound only. You're a little bit too young to get mammograms. But over the age of 30, any breast lump, we're going to work it up with a mammogram and an ultrasound. And I cannot stress enough that if you find a lump, you need to have it worked up because young women, we are seeing more and more young women diagnosed with breast cancer. And is it because our screening is better or because there actually are more women being diagnosed with breast cancer at an earlier age? I don't exactly know. Yeah. But I think sometimes it's easy to brush off somebody who might be 21 or 22 and say, you're too young, you can't have breast cancer. And unfortunately, we have seen it.
And something that's a truth, not a myth. The earlier we can detect it in all cases, the better it's going to be, right? So the very first sign, no matter your age, no matter your gender, if you think you feel something,
absolutely,
speak up.
Absolutely.
Okay, so here's an interesting one. Wearing underwire bras can cause cancer.
That's a myth.
Okay.
That is not true. They can cause discomfort, and they can be uncomfortable for a lot of women. And we are seeing a big shift away from underwire bras, I think, because we are having more options that are more comfortable, that do offer more support, especially for our ladies with larger volume. Yeah. But there is no association between underwire bras and breast cancer. That's a myth. Okay. With my particular patients, I will typically urge them to find something that doesn't contain underwire, because oftentimes if it does rub in the consistent place over and over, that can cause them to have pain, or they'll come in because they're feeling something in the breast that honestly it's caused from the underwire bra.
Right. So it can cause discomfort. It's not going to cause cancer.
Correct.
Speaking of bras, so another thing out there is if you put your cell phone, you know how some women kind of tuck their cell phone in their bra where they're maybe walking or jogging, or like in a little fanny pack close to your chest. Can having your cell phone close to your breast cause breast cancer?
That's a myth.
Okay.
There's not currently any evidence that shows a relationship between the radiation emitted from your cell phone and breast cancer risk.
Okay.
Yeah.
Here's another one, and I think we have hit on this just a little bit, but young women don't get breast cancer.
Myth.
Okay.
It's not as common.
Yeah.
Like I said, the biggest risk factors for developing breast cancer is being the female, gender, and aging. Okay. So it's much more common to be diagnosed with breast cancer as an older adult, but unfortunately you can. Yeah. I mean, we see it. Women in their 20s are diagnosed with breast cancer.
And are they being diagnosed at a increasing rate? Did I hear you say that a minute ago?
We are seeing.
We're not. Maybe not sure why.
Not sure why. I don't know, environmental or it's detection,
or maybe we're just more aware people are doing their exams. Okay. Yep. Okay. Here is an interesting one. So breast cancer always shows up on a mammogram.
That's a myth.
Okay. Talk to me about that.
So a mammogram is not foolproof.
Okay.
And the less dense your breast tissue is, the more sensitive the mammogram is going to be.
Okay.
It's now state law or federal law that women need to receive a letter in the mail after they get a mammogram telling them if they have dense breast tissue.
Okay.
And the reason for that is twofold. Number one, women with dense breast tissue do have a slightly increased risk of developing breast cancer.
Okay.
And that's independent of, with dense breast tissue, your mammogram is a little bit harder to evaluate.
Okay.
Because your breast tissue on a mammogram shows up as white, and abnormal findings like breast lumps, calcifications, anything abnormal also shows up as white. So if you've got a mammogram and it's just full of white breast tissue, it's going to make it harder to detect smaller little abnormal white findings on the mammogram. So those are two independent risk factors. That it can make it harder to evaluate the mammogram, but also having dense tissue does slightly put you at increased risk. So in women with really dense tissue, there's two categories: heterogeneously dense and extremely dense.
Okay.
The mammogram is not foolproof. It's not going to catch everything. And if you feel a lump or there's a concerning finding and your mammogram comes back clear, then we might have to step to getting an ultrasound. We might have to step to getting a breast MRI. I don't want to dissuade people from getting a mammogram because it is still the gold standard, but it is not 100%. And unfortunately, I don't think anything in medicine is 100%. But it is the first kind of line of defense that we use.
And probably why we do it annually too, right? Mm-hmm. I mean, it's the gold standard, but not just to have it done once, to have it done routinely.
That's right.
And so did I hear you say, by law, women who have dense tissue are to be notified so that if you are told that you have the dense tissue, in addition to having your annual mammograms, you could maybe do increased self-checks or be on the lookout for other symptoms, just to be aware that this is the type of tissue that
Absolutely,
you have.
yeah. And we have some patients that will come and see us just to talk about it
Yeah.
because they'll come in and then we end up finding out that their aunt had breast cancer, and then by the time we input how dense their breast tissue is and some of their other history, they may be high risk, and then they may qualify for a breast MRI.
Right, okay.
And they would have possibly never known that
Right.
if they wouldn't have gotten the letter. So I think it gives women a little more bodily autonomy to make decisions about how they want to proceed going forward, and gives them a little bit more ammunition in their pocket on how they want to do their breast screenings.
Yeah, it's a good thing. We should be empowered to know as much as we can about our bodies.
Absolutely.
Okay, that's great. So speaking of mammograms, here's a potential myth or truth. You tell me. If you are called back, so if you've gone to have your mammogram screening and you get a call back, does that automatically mean you have cancer?
Not at all.
Okay.
That is a myth. That is a myth. And I understand it can be incredibly anxiety provoking. I have to make those phone calls a lot with patients, or I'll see them in the office and say, it's read out as a BI-RAD 0, which means incomplete imaging.
Okay.
So when you have a screening mammogram, there are pictures that are taken, and the radiologist will go back and read those. It might not be while you're sitting in the office.
Right.
You may have already left.
Right.
And they go and they look at the pictures, and they might see something, but they don't have a good enough picture.
Right.
So we might need to go in and do some magnification views. We might need to do an ultrasound. And it could be absolutely nothing. But with the screening, it simply means it's incomplete. We just don't have enough to tell you whether or not it's benign or it's not.
So I'm hearing you say that if you do get called back, even though it's nerve-wracking and could be a little bit scary, try to remain calm. It could be a variety of different things, and just get in as soon as you could to have that follow-up.
Absolutely.
Okay.
And I will say too, I think a lot of women may be under the impression that a diagnostic mammogram is superior to a screening mammogram in terms of how effective it is, and that's not the case. The difference between a diagnostic and a screening is a diagnostic is performed while the patient is still in the office. The radiologist will read all of the films before you leave, so that if we need to take more pictures, they can do it while you're there, and then you get the readout.
Okay.
So you're not having a better study performed when it's a diagnostic.
Okay.
It just means if you have a screening and they see something, then you may have to come back from home and take more pictures.
Just to do a different type.
Exactly.
Okay. Double mastectomy guarantees cancer will not return.
That is a myth.
Okay.
Yeah, because you go through all of that.
Yeah.
It's a pretty big surgery. It does reduce the risk down significantly.
Okay.
Down to less than 1%.
Okay.
And that's when I'm talking about recurrence. I'm talking about local regional recurrence. So coming back on the chest wall.
Okay.
So with mastectomies, the vast majority of breast tissue is removed, but microscopic breast tissue could be left behind. So in theory, could breast cancer develop in those cells? It could.
Okay.
That risk is very low. I have seen it happen, unfortunately. But the risk is greatly reduced.
Right. Okay.
With mastectomies, I think a lot of women are under the impression if I have a mastectomy versus a lumpectomy that my lifelong survival will be different, and that is not the case.
Okay.
So it does not matter if you have a mastectomy or if you have a lumpectomy. It doesn't impact your overall survival.
Okay.
It just pertains to what's my risk of it coming back on my chest wall.
Okay. Wow, that's interesting.
Yeah.
Okay. So still a lower chance. And if that's the pathway that you and the physician, the patient decide for treatment, it can lower the risk, but it's not, nothing's ever going to be as guaranteed.
Exactly.
Yeah. Okay, so here's another one. If you're healthy and eat well, you won't get breast cancer.
That's a myth.
Yeah.
I wish it was not.
Yeah.
It's definitely in your favor to stay healthy and to exercise and get adequate sleep and to eat healthy and try to avoid as much, alcohol as possible, but it's not foolproof. And I've seen some patients in my office before that have been, never a sip of alcohol. They exercise every single day. They eat all organic, and they still develop breast cancer. And We may never know what causes it. Even if their genetics is negative, 1 in 8 women are going to be diagnosed with breast cancer, and unfortunately that may be the 1 in 8.
Okay. 1 in 8.
1 in 8.
Okay.
I do still encourage women, though, to try to lead a healthy lifestyle.
Right, of course.
It definitely reduces the risk.
And it reduces the risk for all kinds of health issues and
Absolutely.
conditions, not just breast health. Okay. Okay. Breast cancer always comes with pain.
That's a myth.
Okay.
Yeah. Rarely does it cause pain.
Wow, rarely.
Rarely.
Okay.
Most breast cancers are painless. Even if it's gone to a lymph node, most of the time it's not tender.
Okay.
I generally tell women, if you have a lump in the breast and it's tender, it's a sign. It's a better sign.
Okay.
It's not a guarantee, but cysts tend to be painful.
Okay.
Fibroadenomas can be painful. Mastitis can be painful. Typically, breast cancer is not.
Okay.
Again, I have seen it where it has, but that's not the typical course.
Okay. Interesting.
Yeah.
Okay. Only women with large breasts get breast cancer.
Myth.
Myth.
Yeah.
Okay.
Yep.
Yeah.
I've seen it from A cups to triple D cup. It
Right.
does not discriminate. It can make it harder to evaluate in a woman with a really large breast. So again, mammograms.
Right. Very important. Okay. Here's another good one too. So breast implants cause breast cancer.
They actually do not. There's no correlation between breast implants and breast cancer. There is a very rare type of lymphoma that can be associated with a particular type of implant.
Okay.
A textured implant that actually has been recalled.
Okay. Good.
So they're not putting those in anymore.
Right.
I do see patients that still have them, and you can choose to have them removed and replaced. I have some women that will have them, and we'll do periodic breast MRIs just to ensure that nothing is developing. But that is a type of lymphoma that's associated with the breast implant.
Okay. On those same lines of breast implants, is it harder for a patient who has implants to have breast cancer detected?
Not necessarily.
Okay.
We are able to do implant displacement views with mammograms, and you can get really great pictures with that, and you can really visualize the breast. It can make it a little bit trickier if you have something very far posterior that's near the implant. It can make it a little bit harder to evaluate that.
Oh, you mean if you had like a tumor?
If you had a tumor that was very, very far back in the breast tissue, basically sitting on top of the implant. It can make it a little bit harder to evaluate that. The other thing with the implants that sometimes can pose a little bit more of a challenge is if we needed to biopsy something. We have to be very, very cautious about how that's done because we don't want our needle to go anywhere near that implant. We don't want to rupture or cause any issues with that. So it can sometimes make it tricky, but I generally tell women, if you want to have breast implants, I'm not stopping you.
Right.
Yeah.
Right. And you come get your mammograms.
Come get your mammograms. Yep, you'll be fine.
Y'all will be able to see around it.
Absolutely.
Okay. So continuing on the topic of mammograms, we sometimes hear people concerned about the amount of radiation they might be exposed to through a mammogram. So can you talk about that?
Yeah, and you are exposed to radiation in a mammogram, so it's a valid concern. The amount of radiation, well, let me back up. So we are exposed to radiation every single day of our life.
Okay.
Cosmic background radiation. When you fly on an airplane, you're going to be exposed to radiation. So it's a normal thing in our day-to-day life.
Right.
You're really not going to be able to escape that.
Right.
So everything is a risk and a benefit. Is the benefit of getting a mammogram and having that 42 days of exposure of background radiation, is that a greater benefit than potentially missing a breast cancer diagnosis? I think so.
Right.
So yes, there is some. I don't think it's quite as high as so many people are under the impression of. So keep getting your mammograms. Once a year.
So we have busted a bunch of myths today about breast cancer. But I would love for you to leave us with one truth. So what is an absolute truth you would like us to know about breast cancer?
When you're diagnosed, or if you're ever diagnosed with breast cancer, we have a lot of treatments, and we have had a lot of research in breast cancer, and it has come a long way. And we have a lot of successful therapies that we can use for women so that they have wonderful outcomes and can live a very long life after a diagnosis of breast cancer.
That's great. So how can patients find you? And maybe when should they find you too? I mean, not just a diagnosis, before a diagnosis, during symptoms and concerns. How can people find you and your colleagues?
They can have their primary care OB/GYN send over a referral. They can actually self-refer if they have an issue, and we can get them through the proper channels if they need imaging or surgery. We're happy to help coordinate all of that.
And that's the Williamson Health Turner-Dugas Breast Health Center.
Yep.
So as I'm sitting down chatting with folks, I'm loving asking, what is the most rewarding part of your job?
I love the patients that we work with. I really do. I love taking care of patients from the beginning of their journey and watching them. We have patients that are 10, 15, 20 years out.
Yeah.
So to be able to follow them from start and throughout their journey and kind of hold their hands really is incredible. And you can tell you're actually making a difference. And that feels good.
Yeah.
Yeah.
I love that. Thank you for being here.
You're welcome.
We appreciate
Thank you
the
for
time.
having
and I think
me.
this is great information to give to patients, and maybe we'll have you back to bust some other myths.
Great.
Okay. Thanks.
All right. You're welcome.